Hey audience, let's get into the question of the day. Approximately what percentage of occupational therapists work with children in early intervention in the school systems? Is it A, 27%, B, 17%, C, 37%, or D, 47%? The answer will be at the end of the episode. Hasta luego! Hey y'all, I hope you're well. Welcome to another episode of Healthcare Boulevard. This is a podcast where we shine more light on healthcare, and our goal here is to provide more options to people looking to choose healthcare as a career path, regardless of their background. My name is Sena Kapomo, and I am your host and creator here. I thank you for tuning in. I appreciate your support. Remember, you can tune in on YouTube or wherever you get your podcasts. Without further ado, let's get into today's episode. All right, welcome back, Vodian. How y'all doing? I am back here with another guest. Her name is Priya. Did I pronounce that right?
Yes. That's
okay.
Correct.
That is a very pretty name. I was just telling my husband, I was like, that's
you.
a very pretty name. You want to name our daughter that? She was like, yeah, let's do that.
Oh, thank you.
You're welcome. It's very pretty. How you doing?
I'm good. How are you?
I am well, thank you. Tell us a little bit about yourself, Priya.
So I recently am working at Banner Ocotillo Medical Center. It's a hospital-based setting. Mm-hmm. I majorly work with geriatric population, but my journey started in 2017 when I came to the US. I did my master's and doctorate from University of Southern California and have over 4 years of working experience. And I worked with all the age groups across the lifespan. And when I was at USC, I was focusing, my specialization was in lifestyle interventions, targeting mental health, ergonomics, and chronic conditions.
Okay.
And I'm really passionate about health promotion and wellness. And I look forward to, I always say, adding life to people's years. That's my motto.
Okay. I love it. Yeah. I love it. So when you were in India, what was your education before you moved to the US?
Yeah, so even in India, I got my bachelor's in occupational therapy. So it's like a 4.5 years program. We get our clinical rotations in the last 6 months. But from the day one of our bachelor's program, we are exposed to like hospital setting, hands-on experience. So although like actual clinical experience is just the last 6 months that we count as an internship, but we had hands-on experience for all the 4 years.
Okay.
So, yeah.
That's interesting. Do they have a bachelor's in OT over here in America?
They do. It's just a little different. They don't have it for 4.5 years. They have, I think, 2 years. And then there is a transition program into master's. So people do like a bridge program, bachelor's to master's. But it's completely different because I'm not sure what kind of subjects they cover in bachelor's in the US. But in India, it's completely medical model based. It's very heavy on that. So we study like surgery, medicine, ortho, everything in addition to OT subjects.
Okay.
So, yeah.
Yeah. So then when you came here, was the education here easier for you then?
I would say so because I already had 4.5 years of bachelor's under my belt. My master's was just like 10-month program. It was a post-professional program.
Okay.
And it was at USC, the curriculum is programmed in such a way that it gives you experience in all the fields. That's when I got exposed to ergonomics, therapeutic interventions of like motivational interviewing and lifestyle redesign, all those parts of it. So they have wide array of, topics that you can choose from. So it was completely different. In that sense, it was very heavy OT focused and less medical model focused. So that was the best part.
Okay. And right now, as you're working, you've been working for how long now as an OT?
For over 4 years, I would say.
Okay. Have you utilized both your medical training and your OT training together?
Yeah. I used, like, even at the current setting, at the hospital-based setting, that comes in handy. When I was at skilled nursing facility, that came in handy. So goes hand in hand. It makes an enriched experience.
Yeah. And which of the demographics you work with have been your favorite, since you've essentially worked across the board?
It's difficult to pick up, pinpoint. This was my favorite population.
Right.
I worked with like pediatric population, like 1-year-old, and also like months-old kids, and 103-year-old patient as well.
Right.
And so far, I've loved everyone, like working with all of them. But because a major part of my doctoral experience was lifestyle intervention, where I was specializing in mental health and ergonomics, I would say that is what I love talking about, and I can spend hours together in that. In that field.
Yeah.
But I try to incorporate all of those things in every age group.
Right.
I've tried doing mental health and other ADL type of things as well. Even in older adults, a lot of times what we see in the hospital is they also they have a lot of anxiety about things going on because it's such an acute setting.
Right.
That affects their physical performance as well. So I would say I've loved all of them, like all the age groups. But I love talking about mental health and ergonomics and just that health promotion perspective of it.
Okay, all right. So you got your education in USC. What made you move to Arizona?
So my job.
Okay.
So California was very saturated with all the international candidates applying for jobs.
Okay.
And the only places I was getting jobs were in the interior locations. And at that time, I didn't have a driver's license, although I was driving back in India, but I didn't have it in the US.
Right.
And I was a little iffy about going into the remote locations where there is not a lot of accessibility, even with transportation. And my husband had got his job in Arizona.
Okay.
So he was like, well, you are just testing waters. Why don't you test it in Arizona, since you already got a job here? And we were in a 2-year long distance relationship. He was in Syracuse, I was in LA. So it's like, let's try, let's see if this works out. And I got a lot of job opportunities in Arizona. So I was like, okay, I'm going to be here.
Yeah, no, that's fun. That's interesting. Definitely, that's one thing somebody told me when I first graduated, is they were like, well, don't be afraid to move if needed. If your direct area is not responding to your need, essentially, especially if you don't have any particular reason to stick around, like family or what have you. So that's great. Have you enjoyed it so far?
I love it. I love it more than being in LA, partly for the reason that USC is in a rough neighborhood and I used to live there. So my community was gated, so I felt safe. But otherwise, it used to be like a constant. I couldn't step out of my community after sunset. Even in the mornings, I have to be cautious when I walk because there was a mental hospital right there and people used to get homeless from there. So I didn't feel safe. And here it's ultra, like Scottsdale is ultra safe. I've never even thought twice before moving out in the dark. So I was like, oh, and I've seen one of the best sunsets here. So I was like, oh, that's so good. Yeah.
I love it.
So much more accessible. Like even if my job location is 40 miles away, I'm covering that distance in 40 minutes. Had I been in California, it would have taken hours together.
Oh gosh. Yeah. Now you're making me think, maybe I should go to Arizona.
It's a nice place.
So what did you get your doctorate in?
My doctorate is in occupational therapy,
great.
But it's specializing in lifestyle interventions.
Okay, all right. And why did you make the decision to get your doctorate? Did you get it right after school or did you work and then got your doctorate?
So I got right after completing my master's. I came in 2017 to the US. I did my master's, which was like a 10-month program. And directly after that, I was like, okay, let's just do doctorate. So I started my doctorate in 2018 and completed in 2019.
Awesome. And give us some idea as to what your day-to-day is like as an OT.
right now.
Mm-hmm.
Okay, so right now, so in every setting, your day-to-day differs. So right now I'm in a hospital-based setting. So typically I'm the only OT in the entire hospital. We are not that big of a hospital right now. It just opened up last year.
Okay.
Not last year, in 2020. It just opened up in like late 2020. So I'm the only OT right now in the hospital. So typically I would start my day with chart reviewing. I get to make my own schedule. So nobody assigns me patients. I have like list of people and I can prioritize and pick and choose and see whoever I want.
Okay.
And I can see how many soever people I would like to or I can get to. Typically I would aim to see eight patients in an 8-hour day.
Okay.
So chart reviewing, then going to their room, talking to them, starting the intervention, seeing how they're doing. Major part of hospital-based OT is to aid in discharge planning. So it's about what barriers are there for their discharge. Is their home set up to make them more independent in their daily activities? If not, what items or what DMEs can be used to make them more independent or make their home environment safe? If that is not the case, are they qualified or would they benefit from going to a skilled nursing facility or an acute rehab setting or an outpatient setting? So we are heavily based on that discharge planning because people are not in the hospital for like more than a week or so. Sometimes they're just there for 2 days and then they go to the next level of care. So it's heavily based on that area where we are supporting the patient and their family to get to the next level of care. Yes, sometimes their hospital stay extends and that's when we do heavy OT and interventions. And sometimes they just progress so fast that they are just fit to go home at that point.
Okay. All right.
Yeah.
And what is your I just blanked. Oh, what are some challenges you face in the field?
Some of the challenges I would say, it's not challenge per se, but yes, because there is lack of awareness about what OT actually is and what the scope of occupational therapy is. Even the hospitalists or physician, they confuse it with PT. So it's like, oh, and they take OT-PT as the same term. So they're like, oh, OT-PT, work with them. But it's like different. Even if I haven't worked, they're like, oh, OT-PT, work with them. And I was like, no, I haven't worked with them yet. So that becomes a little challenging because yes, I'm constantly advocating for what I do, why it's important to do your daily tasks. OT is heavily based on activities of daily living, so making them do what they should do what they want to do, right? In the hospital setting. So advocating for those things, even telling to patients that, as simple as brushing your teeth, do not do it in the bed. Try to get up, go to the bathroom. That itself is exercise. You're getting that movement in. So we are working on it. Have the nurses come in and have them take you to the bathroom, because a lot of them they're just in the bed and they're like, oh, it's just brushing teeth, whatever, right? People start taking these small little things for granted when they can actually do things, not those who are like heavily debilitated and cannot do things. So it becomes a little bit challenging in that area. But luckily at this hospital, people are very supportive, like nurses are responsive. If you tell something about OT, like what you want them to do ADL wise, they'll go and do it. And this is my first hospital setting, so I don't know how other hospitals work, how responsive, how approachable they are. But luckily in this environment, people appreciate therapy. So they would be like, oh no, go ahead, do things. If you need anything, let me know. I'll make it a point that I'll have them walk to the bathroom and have them do these things. So gets a little bit challenging, but at the same time, because of the environment, makes it easier.
And so that sort of answers my next question, which is, what are some people in your team? So you are working, you're in the hospital, there are nurses and doctors. As far as your decision making as an OT, do you have anyone in your team, or you just making every decision and then the nurses and MDs are implementing that?
So when it comes to discharge planning, yes, OT also has an input in it. Physical therapists also have their input in it. So depending on how much they are walking or how much distance they are covering in a day, that heavily affects. A lot of times with daily tasks, they are able to do things like putting on clothes, toileting, showers. They are able to do those things. But endurance wise, they are not meeting that distance goal that they need in order to go home. So then that decision making is shared between physical therapy, occupational therapy, medically where they are at. So there are like three I would say healthcare fields which have an impact on that decision planning process.
Okay. And how is the stress with this position?
It gets overwhelming, like when there are just a lot of evaluations coming in every single day. Like literally I have had 20 evaluations plus 20 treatments and I'm the only one. Luckily my manager never pressurized me into anything. He never questioned me, so he took that pressure off. So there was no physical pressure from like people, my superiors who's questioning me like, oh, why aren't you getting things done, what's going on? But just personally speaking, when you look at that list, it's like, oh my god, there's so many people and they are waiting on OT evaluations to get done and then have your input. My case management team is good. Like they are the ones who coordinate everything, the therapy, the medical, insurance, everything. They are the ones who are coordinators. So if something happens, they're like, oh, this patient needs to be seen before, would you be able to see them? So then you're like, okay, you did not plan to see this person, but you go in and have to see them, right? And most of the time I've already evaluated, so I know the person, and since I'm the only one, I don't have to go back to the notes to see what is their level of independence, how much they're able to. I was like, okay, so I'm cruising. I was like, okay, I know this person, I can just go, and even if they tell me in the middle of the day that person needs an updated note to go to an acute rehab place, I was like, okay, I can just go in, I can work with them and come out. But it gets a little stressful where there are just so many patients physically on your list and you are just, okay, done. You saw this person done. You saw this person done. And what I sometimes miss is not being able to treat them. Like I just see them once because I just have too many people. I'm the only one in the hospital, so I get stretched pretty thin. So it's like, I would love to see this person again, but I don't have the bandwidth to see them again.
Right.
So that gets stressful right now. But as I said, I love my team. Like even my therapy team, the physical therapy team, they're so good and supportive about me. So they'll also let the patients know that, she's busy, but she'll try and come in and work with you as many times as possible. They'll support me in any ways they can. So if they know certain people are high priority, because they get to evaluate them first, because there are like 4 PTs in the hospital. So they're like spread out. So they're like, hey, even if you don't see the person, that's all right, just see this one, something like that. So it makes my work easier to prioritize. I'm like, okay, I can just let them go, they're independent or something.
And what is besides the OT, how do you deal with that stress?
So I like to think of myself as someone who has high threshold for stress. I won't break down that easily. I like my own quiet space, especially during lunch. So it's my downtime. So I was like, okay, I'm by myself. I can control the situation. And I think about it like rationally as like, what's the most I can do? It's not my fault. Nobody's blaming me anyways, but it's just the way how I cope with my own stressors. It's all right, you get to people, you don't get to them, you don't. So a lot of self-talk. My husband helps brainstorming things, calming me down as well. Like I can talk to him and he'll give me an unbiased decision, or just unbiased listening, like, okay, this is going on, you should think like this. A lot of self-talk and time management. So I was like, okay, this is my day. I I'm old school in that way. So I like to like highlight things like these patients blue, they are blue. So I'm just going to see the blue ones, not everybody else on my list. Checking them off. So I like the checklist. So that gives me that mental satisfaction that check. I saw the person. Check. I saw the person. And I'm a little, I would say, I don't like when other people play with my list, like on my sheet. I was like, I don't like that.
It's my sheet.
Like they're just making my work easier. But I was like, I would rather have it do it my way. So it's organized in my thought. And I just plan my entire day in my mind. I was like, okay, I'm going to see everybody on this floor first, then go to this floor, document, see how it goes. And that should be it. So a lot of organization, planning ahead, self-talk can help me really cope with these things.
Okay. And how is your work-life balance?
My work-life balance is pretty good. Like I get to do things that I love at home. So once I'm home, I am not stressing about my work. So I'm like, okay, work is work. I leave my work self behind. I come home. It also gives me a lot of time to do other things like today. I'm able to do this. After this, we have planned like a hike to go. So I was like, okay, it's like pretty much organized in that fashion that I can do things I love to do. And I keep it that way. On the side, I also love to like publish articles and present in conferences. So because of that distinct compartmentalization in my head that work is work, you come home and you leave it there. I get inspired by my work in that sense. So a lot of my publications and presentations are inspired from that work, and that gives me that sense of satisfaction that okay, this way I'm able to focus on other things as well and helping me grow. So I would say I like it this way.
Yeah. Okay. That actually reminds me, you were at a presentation last weekend. How was it? What was it about?
Yeah. So I was actually, I have my session recording on Monday, but I had to submit my presentation for approval last week. So I was like, okay, last week I need to complete that. So we have an upcoming national conference, the American Occupational Therapy Association's annual conference is in March. In Texas. So people from all over the US and also internationally come for that conference. And I'm presenting on work from home during COVID-19 and navigating ergonomic challenges through OT. And I'm presenting a 1-hour short session in Texas this March. So I had to do a lot of that work and submit it to get it approved and then get ready for session recording on Monday.
How was working from home? Working in the middle of COVID. I mean, we are still in the middle. We've been staying in the middle of COVID forever. At some point, hopefully, we'll see at the end. But let's see how that goes. How was working there, especially at the height of it, for you as an OT?
Yeah, so I never worked from home. So I always had to go to the field, as you know. It was stressful initially because things were so new and the gravity of it was so much that it was almost scary, you know. I was working at a skilled nursing facility at the time, and a lot of older adults were getting like COVID and they were put in isolation, and people were still figuring out what to do, what not to do. You are scared for your life as well, but you're also scared for your patient's life because they're so old and fragile. They have multiple comorbidities going on. Saw deaths there, and just like it was just painful at that time. Slowly transitioned from skilled nursing to an outpatient setting. So it wasn't as much as I would see in a skilled nursing or a hospital. It got better then. Kids used to come in like, yes, the level of precaution was less. We just had one mask. You don't have the entire PPE. So if a child comes in sick, you are like iffy, but you see them, right? So there was a different kind of challenge going on at that point. I still remember there was one time where for 3 days, the entire therapy team was out to get tested for COVID because we had a couple of patients we didn't know had COVID. And that was a little stressful because there's no rehab team in the clinic. And that's all. Rehab is all we had in the clinic, and they were running without the rehab team. Like they were just there for administrative stuff. So it got a little stressful then, and then transitioning out of outpatient now in hospital setting, we see a lot of COVID patients, but I'm not as stressed about it. It's like, okay, now it's part of life, like, oh, you've got COVID, we'll work with you. That's okay.
It's so weird, but you're right. It is part of life now.
So even if they haven't tested yet and they are having some symptoms, we are not scared to death. Also, all of us are vaccinated, but they are also physically doing well. So it's not like their health is at major risk. They're like, oh, I'm doing okay. They are on room air. They're not needing oxygen or anything. I was like, okay. I think this is just going to be the new way of living, People just would continue doing what they do, which is partly good because it's not affecting them as such. But then at the other hand, there are these gravely sick ICU patients, and it just breaks my heart. Like there are young people coming in who are completely all right. Like there are a lot of people I'd seen in the hospital a month ago, and they were completely independent. And then now they're in the ICU, they are on ventilator, and that's their life. Like they've been there for a month now and not able to do anything. It just breaks your heart to see them, because especially you saw them a month ago and you know how well they were doing. And suddenly one thing changed and their life just got flipped. So,
that's outrageous. That's scary. That's for sure. Working outpatient myself, I see, like you said, I see I'm doing well. The worst thing I would say is like somebody who is asthmatic, and so they're having like shortness of breath, and treating them with just treating the inflammation and having them come back. And 99% of patients I've seen have been mild to moderate. So, outpatient. But so I get to sort of like the fact that there are people in ICU and on ventilators, I know that's a reality, but for me, in my work setting, it's not something I'm exposed to. So I'm like, okay. Okay, I will deal with what's in front of me. So sometimes when patients are asking for like a whole lot of things, when they're like barely just having sore throat, and I'm like, listen, it's bad for you, but it's not that bad. You will be okay. You just treat it like a common cold, okay? Isolate and you'll be all right, But it's a very good point that we do have those parallel of folks who are doing totally fine and those who are not doing totally fine. But that being said, what are some growth opportunities? And you sort of already spoken based on what you are doing, some growth opportunities for OTs.
So I would say it's a very budding field. Like people can literally do anything and everything in OT. That's what I've realized if you have the right tools and resources. So up until I came to the US and started studying at USC, I was like, okay, OT, it would either be ortho, neuro, pediatrics, these kind of population you can see. Yes, mental health, but not sure how much, Coming to USC, it just opened up my perspective. Especially with lifestyle interventions, it was basically behavior changes. And as far as there is something people want to do, and they're not able to do, you can problem solve around it. And once you have those tools, the right questions to ask, how to facilitate a change, you can literally venture into any setting, be it the corporate world, be it the schools, hospitals, outpatient, research, academia, just coming something out of new. Like I've seen people in my class who started their own practice, ergonomics on wheels. So so that idea was to go from place to place and give them ergonomic solutions. I think like their clinic would be their van or their vehicle, and they do that kind of thing. But what I love, that's what I love about OT. Occupations, like occupational therapy, occupations, anything that's occupying your time. So anything that occupies your time, you can intervene.
Yeah.
So if you have your mind on it, you're creative, people can actually do anything and everything.
Yeah.
So health and wellness, it's a very new and unconventional side of OT, is what I like to say. Not a lot of people know what actually OT can do in that field. And it's just amazing what OT can actually do in health promotion and wellness.
Yeah.
You want to get into like mental health counseling and lifestyle interventions with treating or dealing with anxiety, stress, depression, you can still do that with OT. Weight management, diabetes management, substance abuse, smoking cessation, alcoholism, neurological conditions, even in the college student interventions, like what kind of, like there's an entire team dedicated to helping college students with lifestyle interventions. So that's completely different. Like at my time we had these because we had a lot of people from USC itself, like our patients, they're like young adults, and they have different set of problems and challenges in their day-to-day college life, right?
Yeah.
And you can do lifestyle intervention to make them more successful in academia, like successful in education, like how can they get better. So if you have the right tools and resources, you can actually go in a wide array of settings.
Wow, that is a wide range of places you can work in using OT. What do you do? And you sort of told us that too, is to keep your education up to date, right? Essentially, because as you know, medicine and health, everything just changes over time. I'm sure OT now and OT 5 or 10 years ago is different. So what do you do to sort of keep up with what's happening in the field?
So a lot of continuing education programs help with that. When I publish articles, you have to come to up to date with the evidence present, right? So you are reading a lot of research papers, and the best part is when you publish, your evidence has to be within the last 5 years. It cannot be older than that. So you are constantly like, oh, the older studies said this thing, but now this is what's happening. So a lot of continuing education helps to keep me up to date. Publishing articles, presenting at conference, because you come to know what are new things that are going on and what other people are doing. So that helps a lot to keep my knowledge up to date. Just sharing it with my friends or even with PT colleagues. They'll teach me something, what's going on in their field is like, oh, okay. You constantly learn every single day from other people you work with as well. That helps.
I bet. Lastly, what would you advise to those who are wanting to get into the OT field?
I would like to tell them that keep your mind open, and there are a lot of opportunities and possibilities outside of the conventional side of OT. And if you set your mind to it, you can get creative with it and play with the field. Like there is a lot of freedom within the field as well. And it would be satisfying. And at the end of the day, you will feel fulfilled. So just keep your mind open, go for the endless opportunities right in front of you. And you would feel through it.
Awesome. Well, Priya, thank you so much. Is Dr. Parek?
Dr. Priya is also fine. Priya is also fine.
I was like, let me put some respect on her education. Thank you so much for taking the time to be here with me. I really do appreciate it. This have been a lot of information, a lot of new information about OT, and that's why we do this. I really appreciate you taking the time out of your beautiful weekend. Enjoy your hiking.
Thank you. And thank you for having me here. And I really appreciate what you do for the audience and trying to just have different healthcare fields and professions out there for people to be more aware of it. It really means a lot to people.
Of course. We are out here. We're doing so much. We're learning from each other. this is the best way I can, contribute. And I found. And I appreciate you and everybody else who's being here, just being open to taking the time out, because we know we are busy people. I haven't met a professional who is not busy, that's for sure. But as you said, most of us are getting better at balancing work and life, and being great at what we do, and yet getting away from it when we are not there. So I think we're getting better. I actually had an interview yesterday with a cardiothoracic surgeon who is on this mental journey that he wrote a book about like balancing and just being humble as a healthcare provider. So it's definitely I think we're opening our eyes for sure. Like, okay, there is more to life than wearing the white coat and treating and consulting with patients. So I'm excited to see where it goes. I really am excited to see where the field goes in terms of providers caring for themselves.
Yes. Me too.
Yeah. But all right. Thank you again, and have a beautiful day.
Thank you. You too.
All right. Bye.
Bye.
All right. I'm back. And the answer is A. Approximately 27% of OTs work with the children in early intervention and the school systems. Adios. All right. That's all I have for you today. Thank you again for joining me. I appreciate you. Please subscribe, follow, like, comment, and share. And stay blessed. Bye.